Yeah.
New South Wales has become the latest Australian state to issue a measles alert following Queensland and Victoria. Queensland's Chief Health Officer has even taken the unprecedented step of writing to parents whose kids are unvaccinated.
The measles outbreak has once again reignited the immunisation debate, of course, and this morning we are exploring both sides of the argument. Meryl Dorey
from the Australian Vaccination Network joins us. It's a group of people concerned about vaccination risks. She joins us from the Gold Coast. Here in the studio we have Professor Peter McIntyre from the National Centre for Immunisation Research and Surveillance. Good morning to you both.
Good morning.
Now, first of all, to you, Peter, this latest measles outbreak, how serious is it, and what are the the potential effects?
Well, the only reason it looks serious is because we have so little measles. Yeah. I mean, Australia has basically gotten rid of its own measles. So the only measles we get now is measles from overseas. And what's been happening in all the states, Queensland, New South Wales and Victoria, is Bali is having a measles outbreak. So in fact, what's happening is people who are not themselves immunised going to Bali from Australia are bringing measles back to Australia. And so, and the problem is that there'll always be some people who are not immune against measles, some people who didn't get vaccinated, or some people who have other health problems, immune systems not so great, etc., who haven't responded to the vaccine. And that's one of the big reasons to have the measles vaccination rates as high as possible, to protect those people who we can't protect with the vaccine because, their health won't allow it.
Yes, indeed.
Well, the Queensland's Chief Health Officer has written, and I'm assuming this is a first, to the 10,000 parents that don't have their children immunised. Do you think that should be across the country?
Well, in fact, parents whose children aren't fully immunised get regular reminders anyway. That's something that happens via our register. And of course, if your child's in childcare and you are wanting to get the childcare benefit, you also need to have that child immunised to be eligible. So there are regular reminders happening anyway. There have been things done like this before. New South Wales wrote to parents a year or two ago. Queensland's just done it. And I guess the idea behind that is to just highlight to people, now look, we've got a problem here and you really need to get on with it if you haven't done it.
But did that improve the numbers? Because obviously I think if they haven't immunised their children, they feel quite strongly about it.
Well, I think there's really two groups of people whose children aren't immunised. There's people who've got, significant problems in their lives, or, challenges because of being single parents, or having lots of other children, or, just life is just difficult.
Right.
And we need to try and make it as easy as we can for people like that to be able to, access the free immunisation services we have in Australia. And there are people who are concerned for various reasons, and a lot of the time, in fact, they're concerned for the wrong reasons, and they've got bad information, such as the information which unfortunately comes from Meryl's organisation.
Well, now let's bring in Meryl on this. Meryl, it seems that there are a number of chief concerns for people like yourself who oppose immunisation and vaccination, but it does seem a lot of those concerns have been addressed. So can you outline them for us?
Well, first of all, I have to correct Professor McIntyre, because he said that parents who don't vaccinate their children won't be able to get them into school, preschool or childcare, and that's not correct. All you have to do is register as a conscientious objector. Now, with measles, it's an interesting situation, because in the 100 years before the measles vaccination started, the death rate declined by 99.5% without a vaccination. Then the vaccine came in 1969 and took credit for this decline, when credit was not due to the vaccination, credit was due to other causes. Now, we have a situation where Queensland Health is reminding 10,000 parents that they haven't vaccinated their children because 11 people in Queensland, mostly adults, and probably at least some of them vaccinated against measles, got measles anyway. And what we're ignoring is the current situation that we see in Australia, where every week up to 1,000 Australians are dying in the public hospital system alone from adverse reactions to properly prescribed medication and hospital-borne infections and medical error. This is the elephant in the room. If the government and the medical community are really concerned about the health of Australians, why aren't they doing something about this obvious huge cause of death in Australia, instead of worrying about measles, which basically, when the vaccine came in, it was called in the medical literature a common and benign disease of childhood. It wasn't until the vaccination came in that we started to hear that measles was a deadly disease in this century. So let's put the money and the emphasis where it belongs in trying to stop people from dying because of medical error and adverse reactions to drugs.
Well, I can tell you my cousin was born deaf because his mother had the German measles while she was pregnant, which had a huge rise in the 60s in this country. And in fact, at the Murdoch Children's Research Institute, where I am an ambassador, we've been doing some interesting research on the tuberculosis vaccine, which we don't give to children anymore. And the rise in allergies, we're starting to see a link because the tuberculosis vaccine, when it was given, kick-started a baby's immune system. So allergies that are on the rise in our country, 1 in 10 children, I mean, there are other benefits even outside of the traditional disease that they're vaccinating against.
And measles, of course, is only one of the vaccinations we receive. Peter, I mean, how do you respond to Meryl's concerns?
Well, I think Meryl's concerns are ill-founded. In fact, it's just like the other stuff you read on the AVN website, which, for someone who's looking for information, it's basically like a superhighway to garbage information, the sort of stuff that you see on their website, unfortunately. And what Meryl's just said about measles is partially correct. So it is true that death rates declined because we got antibiotics, we got better medical care, and people were dying of complications like that. But there's this hard core of complications from measles, like encephalitis, which is inflammation of your brain, and something really scary, which has a long name, SSPE, which is actually a delayed encephalitis. So the child looks okay, and then 10, 20 years later, they get a brain rot. And both encephalitis and SSPE cause people to die. And it doesn't matter how good your diet is, it doesn't matter how healthy your lifestyle is, you can still be one of the unlucky ones that gets measles and has either severe disability or dies. And that's what we can prevent with the vaccine, and that's what we've managed to do, to actually get rid of all deaths from measles and in fact get rid of measles from Australia. But as I said, what we've still got is measles overseas.
Meryl, I mean, many people would listen to you and say, okay, well, I suppose there might be some cause for concern there, but why not be safe rather than sorry?
Well, let's put it this way. The Australian Vaccination Network represents thousands of families. Some, like my own, have children who were permanently injured by vaccines. Some, unfortunately, have even lost children to vaccination. We are passionate about children's health. We care deeply about the health of children. Parents have valid concerns. They're asking good scientific questions. And unfortunately, the government is not providing enough information. Now, the last time I met with Peter McIntyre... The questions might be good
scientific questions, but haven't the questions been answered in a really good scientific way?
Well, the last time I met with Peter McIntyre a couple of years ago, we discussed the possibility of starting a study that has never been done anywhere in the world. And it's a study that compares the overall health of the fully vaccinated with the fully unvaccinated. And because we have the Childhood Immunization Register, we're in a position to do that study cheaply and easily. We could become world leaders in vaccination science. And instead of the government putting its money towards this, they've chosen not to do this study. Now, I would like to extend the hand of friendship and cooperation to Peter and to the staff at the NCIRS. Work with the AVN. Let's do this study. Let's prove once and for all that fully vaccinated children are healthier and more protected than fully unvaccinated children. I cannot think of one parent in this world who would not vaccinate their child if the information was there to show that their children would be healthier if they were vaccinated. But until that information is there, parents are going to continue to err on the side of caution, especially parents who've already had a child affected by vaccines.
So the study proposed?
Well, in fact, this study is still in the planning stage. It's actually more complicated than Meryl suggests. But no, we're keen to see the best quality evidence, and we have no doubt what the outcome will be. I mean, we've seen very recent evidence with things like meningitis due to Hib, which when I was training as a paediatrician, there'd be 500 700 children a year who would get meningitis or another really nasty thing called epiglottitis, both of which could kill you. And in fact, meningitis, even if you got better, often you had long-term handicaps. We don't see that anymore. You know, we used to have 600 or 700 children. Now we have less than 10. And that didn't happen by some magic change in the last 10 or 15 years with, you know, everyone having a better lifestyle, right? And similarly with pneumococcal vaccine, another cause of meningitis. And of course, we all fear meningitis. It's very nasty. Well, that vaccine has almost eliminated the types of pneumococcus that the vaccine targets, and we're now expanding to try and get even more types of pneumococcus covered. We've had the meningococcal vaccine, again something, you know, very, very scary.
And whooping cough as well.
Well, whooping cough, you know, has not been such a good story as the others because we've still got the problem of babies too young to be vaccinated.
It's happened to my daughter.
Yeah. And we've still got the problem that the vaccine does wear off over time. But I guess the good thing about the vaccine is that once you've got it, it protects you really well against bad whooping cough. It's not so good against mild whooping cough, but against bad whooping cough it's very good. And the next step we're looking at is, can we either give the mother the vaccine to the mother during pregnancy or to the baby immediately after birth to try and protect those very young babies that are too young to immunise at the moment.
Well, we're going to have to leave it here pretty shortly, Meryl, but you must be pleased to hear that, as Peter says, that the kind of study you're talking about is in train, or at least in the planning stages.
I am very happy about that, and I hope that Peter will contact me and give me some information about that, and we would love to work with the NCIRS on this study, and I really appreciate him doing that. Thank you.
Terrific, Meryl. Thanks for joining us. Thank you, Peter.
Thank you.
You know, it's one of those debates that doesn't seem to go away, but, you know.
But that sort of study would put a lot of parents' minds at ease, including my own. Even though I believe in vaccination, you still have that doubt when that needle goes in the arm. So,
Indeed.